What is the permanent solution for stomach ulcer? Like, how can someone get rid of stomach ulcer completely? Because many ulcer patients have been taking omeprazole, they've been taking antacid, many have been taking antibiotics. Yet, the highest they can get is a short-term relief. Is it that ulcer does not have a permanent cure? Well, ulcer have a permanent cure. You can get rid of stomach ulcer, and that's why I am making this video. At the end of this video, you will understand what causes ulcer, how to get rid of ulcer completely, and what you need to be doing or to avoid to make sure that ulcer doesn't come back again. Please get a pen and paper. This is going to be interesting. Make sure you jot down. Okay, let's start with the basics. What causes stomach ulcer? How does stomach ulcer happen? I believe that if you understand what causes stomach ulcer, it will be easier for you to understand how to treat it. And as a matter of fact, the treatment of stomach ulcer depends on what causes it, or rather on what caused it. There are two major causes of stomach ulcer. The first one is an infection known as H. pylori infection. The second one is regular use of painkillers. These are the two major causes of stomach ulcer. It is either caused by an infection or it's caused by regular use of painkillers. Let's start with ulcer caused by H. pylori infection. H. pylori is a bacterium that goes into the stomach, damages the protective mucus layer that protects the stomach against the stomach acid. When the stomach becomes exposed to the acid, it can develop wounds or ulcer. But how do people get this H. pylori infection? Most people get this infection through unhygienic means, like eating fruits that is not properly washed, eating meat that is not properly cooked, not washing your hands after making use of the toilets, kissing someone that has the H. pylori infection. The second common cause of stomach ulcer is regular use of painkillers like diclofenac, ibuprofen, piroxicam, meloxicam, naproxen, aspirin. These painkillers are classified as NSAIDs, and they work by reducing the stomach protection, the mucus layer that protects the stomach against stomach acid. Yes, they will reduce your body pain, but they also reduce the protection your stomach have against stomach acid. And when you use them regularly, you can develop ulcer. So in this video now, I'm going to explain how to treat ulcer caused by H. pylori infection. In the next video I will release, we will discuss how to get rid of ulcer caused by regular use of painkillers. Now let's get started. Before we proceed with the treatment of ulcer caused by H. pylori, I want to state that this video is for educational purposes only. Please, any medication I mention here is for you to cross-check with your healthcare provider. Okay? Don't self-medicate. In the treatment of ulcer caused by H. pylori infection, there are three stages of treatment. The first stage is getting rid of the bacteria. The second stage is healing the stomach, that's healing the wound in your stomach. The third stage is measures you take to avoid ulcer from coming back. Okay, so now let's start with the first stage. The first stage needs four medications. This is known as quadruple therapy. Quadruple means four, meaning you need four medication for it. There are different ways to treat ulcer caused by H. pylori infection. But this quadruple therapy I will explain in this video is the most effective way currently. And if you can do it the way I will explain and follow all the instructions, in the next 6 months, that stomach ulcer that have been disturbing you for years will become a thing of the history. Like I said before, get pen and paper to jot down from here. If you know you can jot down, save this video and make sure you subscribe because I'm going to be releasing more educational videos like this. The first medication here is omeprazole. Omeprazole is a proton pump inhibitor that helps to reduce the amount of acid your stomach produces. The second medication is bismuth. Bismuth is a stomach coating agent that coats or protects your stomach against the stomach acid. The third one is tetracycline, a common antibiotic but very effective in stopping the growth of the bacteria. The fourth one is metronidazole or flagyl, also a very common antibiotic but very effective in getting rid of this bacteria. These are the four medications known as quadruple therapy for getting rid of H. pylori infection. You take omeprazole starting from the first day. Get 20 milligram of omeprazole. You'll be taking one capsule in the morning before breakfast, one capsule at night, 2 hours after your dinner. Then metronidazole, you'll be taking 400 milligram morning, afternoon, and night. You make sure that you eat before you take it. Tetracycline, you'll be taking 500 milligram. That's 2 capsules, but it usually comes in 250 milligram. You take 2 capsules morning, afternoon, and night. This month, you will be taking 30 ml. It comes in liquid. There's also the tablets. You can get the tablet if that's what you can get. But if you get the liquid, you take 30 ml morning, afternoon, and night like that. You take this medication for complete 14 days. If you are pregnant or breastfeeding, you shouldn't take this treatment because you cannot take tetracycline. If you are taking flagyl, don't drink alcohol. If you are taking tetracycline, space it from milk, tea, or any multivitamin you are taking because they can reduce the effectiveness. If you are a healthcare professional, this video is actually for you. But if you're not a healthcare professional, don't take any medication here except you consult a healthcare professional. Now, let's go to stage 2 of the treatment. In this second stage of the treatment, you need one medication and 3 supplements. And this stage should be started immediately after finishing the first stage. That's after 2 weeks, you start the second stage. Please, this video is for the treatment of ulcer caused by H. pylori infection. I'm going to release another video on how to treat ulcer caused by irregular use of painkillers. You can click on the subscribe button so that when I post that video, you'll get a notification that I've posted it. Now let's continue. You need one medication and 3 supplements. The first medication is omeprazole, which you took in the first stage. You continue it again in the second stage, but this time around you'll be taking one daily, one in the morning before breakfast. You will take it for another 2 weeks. You also need zinc carnosine. Zinc carnosine is different from the regular zinc, but you can also get this one from pharmacy. And if you are finding it difficult to get it, you can let me know in the comment section. I may be able to help you. This one is formulated to promote healing of ulcers in the stomach. Get zinc carnosine and take 75 milligram morning and night. You can take it for 3 months. Or get 150 milligram and take it once daily for 3 months. Then you also get chamomile tea. Chamomile tea is a herbal tea that promotes healing of ulcer and also makes you to sleep very well at night. You need it as an important part of this treatment. Get it and be taking 1 glass at night before going to bed. The next supplement you need is a probiotic. Probiotic because you have been taking antibiotics back to back for 2 weeks. So you need the probiotics to bring a balance, to balance the normal flora in your stomach. You take it for up to 2, 3 months, depending on the brand or the quantity you got. You can get daily probiotic by Nature's Fitness, okay, or any other good brand you can afford to get. The third stage of this treatment and the final stage, which I consider the most important stage, because if you don't keep to this third stage, the first stage and the second stage becomes a waste. These are the rules you must obey if you don't want ulcer to come back again. In fact, if you have never had ulcer, obey these rules so that you will not develop ulcer. Okay, the first one is that you must run away from any painkiller: ibuprofen, diclofenac, naproxen, aspirin. If you're having body pain, use paracetamol or get the gel, diclofenac gel or cream to massage your body, or ask a healthcare professional to recommend something that is not corrosive on the stomach. Another thing is that you need to take your personal hygiene seriously. When you buy fruit, make sure you wash it properly before you eat. If you go to the toilet, wash your hand properly before you eat anything, before you touch anything that will empty your mouth. And if your partner has H. pylori infection, let the person get treated so that you will not contract it again through kissing. I forgot to mention something in the first stage. When you complete the treatment for 2 weeks, that first stage, then wait another 3 weeks, go and do the H. pylori test again to be sure that the bacteria has been completely eradicated. Okay. Then another tips or measures you should be taking to avoid ulcer from coming back is try to reduce the amount of stress. Stress can actually increase acid production. Try to be sleeping well and avoid self-medication. Also, try to be eating. Okay, try to be eating.